What I'm really excited about in healthcare today is the ability now to focus on meeting the comprehensive integrated needs of each individual, and that we are aligning incentives across all of the stakeholders in healthcare, whether it is the people who pay the bills, whether it is the reimbursement to the delivery system, or whether it is the new benefits that people are getting. All of those are now starting to align to give us the opportunity for meeting the unique and individual needs of the person comprehensively, and really focusing in on then the quality of care and how we can prevent illness from occurring so that the care management needs are going to be diminished and people have the chance to live healthy and wonderful lives. I think what's happening in Nashville to make that happen is a very important experiment that's happening here. You have got very innovative companies that are producing really good, integrated, comprehensive, quality-based care, and you've got very enlightened people who are paying for health care to help provide the financial stimulus to make that happen.
Hospitals have always done a good job serving their patients and their communities in the United States. We have the best hospitals in the world, bar none. But we're entering a new period in which, from government, from payers, from consumers, there are demands for accountability, and there are new rules regarding readmissions and quality value payment, and hospitals are having to adapt to the challenges of being more transparent and working with government and other payers on those things that are now required of them. It's coming out to affect hospitals in ways that I'm not sure were always anticipated. There's more paperwork, but on the other side, there's more information, there's more understanding of the workflow and the processes in hospitals. And I think at the end of the day, this accountability will lead to even better care and improved care from the hospitals in the United States.
Healthcare has always been a very complex endeavor, and very confusing to a lot of our members. The ACA has only made that more complicated. In order to try and help our consumers figure out this complicated and difficult landscape, we've tried to do a number of things. In addition to our broker support that we've had for years and digital platforms and websites, we've recently opened a Blue Cross Center at 100 Oaks Mall, and we have a mobile unit that we've employed to try and educate our members and help them navigate this difficult and complex system. As we go forward, we think it's only going to get more complex, and we're going to continue to look for creative ways to help our members understand and navigate this environment.
So yes, Aon Hewitt was very excited to be the first to market with a private health exchange. We feel it's been very positively received in the market by all of the stakeholders, both the employers and the employees. In fact, I'm a living example of an employee in a health exchange. And so going forward, I think we're excited because we have more and more employers that are interested in an exchange from different industry segments, as opposed to in the initial years where it was just the retail. We now have representations from all industry segments. As well as I think we've had a good experience working with the carriers in our exchange to understand what is necessary to get a competitive market going with the intent of reducing costs, simplifying administration, and making for a better consumer experience. I think in 2014, 2015, we're really going to start to see a partnership between employers and employees for how healthcare is delivered and how it's consumed, and just that engagement between the two. It's really, I think we're on the cusp of a partnership. No longer one takes care of healthcare and one receives healthcare. I think we're all going to be in it together.